The simplest way I can explain how SDF works is it is a antimicrobial liquid that we place onto the cavity. The silver also binds to the damaged part of the tooth, and combination it helps prevent the cavity from growing quickly, and it slows down the cavity progression. In some cases, it works really effectively and can even stop the cavity from progressing altogether. That works best in the beginning stage cavity lesions, but it's a way to basically buy time in cases where a child is not able to tolerate treatment. But it's case selective. It's really helpful in many different scenarios. The ideal candidate for silver diamine fluoride is for a child who has really small cavities that are just starting to form, or for a child who is unable to tolerate dental treatment or continue with dental care due to some type of medical compromise. Again, we use it for a variety of scenarios and it's all case dependent, but we see nowadays that actually up to 28% of children before age 3 do develop cavities, and children below this age have extreme difficulty staying still for a traditional filling. We often use silver diamine fluoride in these scenarios to buy time until the child is old enough and can complete dental treatment in a traditional manner. So, one side effect of silver diamine fluoride is it does create a dark stain wherever any damaged tooth structure is. But most of the time, when people do utilize silver diamine fluoride, it's for a cavity that's starting to begin where most cavities do, which is in between the teeth, where the floss snaps through your teeth. So in these cases, you really can't even see silver diamine fluoride. It's something that the dentists can see with a mirror and a bright light, but most people can't see it. In cases where a child has a big cavity anyways and a dark spot on their tooth, if we do use silver diamine fluoride, that's just really changing the shade of the cavity from a dark brown to a darker brown or dark black. It's still discolored. It's still something that is not, a normal natural enamel shade. But I tell kids that the benefit of seeing that discoloration and is that means the silver diamine fluoride has is working. That's where it's binding to the cavity and helping your tooth. So that's how I explain it to kids. If they do see a spot where that's darker, where it used to be lighter brown before, I let them know, well, that's your medicine working and doing its job. And don't worry, that's something that we can try to cover up later on. So, silver diamine fluoride has been really helpful with our management of medically complex children. We see a lot of children who have cardiac defects, organ transplants, and these children have a lot of restrictions in what they're able to do in the dental office. But we also have to, manage infection for these children. Dental infections and somebody who has had any kind of organ transplant or a child that's going through a cardiac surgery, that dental infection can actually transmit to the organ or transmit to the repaired heart and be a life-threatening problem. But these children also have restrictions in their use of lidocaine because there's epinephrine in there, and also the numbing medicines that we use have some, effects on the heart. So in these cases where we're really restricted in terms of what we can do, silver diamine fluoride is an excellent tool. And simple application, brushing onto a cavity has helped children from undergoing a full treatment under anesthesia in the hospital. Those procedures also do have risks, right? Especially in a medically complex child. So there's a lot of benefits to silver diamine fluoride, and we're grateful to have that tool in our arsenal as pediatric dentists. In my opinion, silver diamine fluoride should be offered in every single dental office, but not all dentists are familiar with silver diamine fluoride, and not everybody has experience with it as well. It's also not always a final solution. There are often structural defects in a tooth, and those ones do need to be repaired by traditional methods. But we do offer this option because we realize, every child is different and every scenario is different. And prevention is the best type of healthcare there is. So if we can do something simple, non-invasive for a child that will help prevent future dental care or dental treatment, that is, the most minimally invasive and best kind of care we can provide for a child. So silver diamine fluoride is literally a 1-minute procedure and can sometimes be squeezed right into the examination appointment. A filling appointment, on the other hand, is about an hour. This is also 1 hour missed from school. This is, time missed from work and a lot more stress than just a 1-minute flossing or brushing application. So, again, prevention is the best type of healthcare. And when we do see cavities that are just starting to form, we'll usually recommend silver diamine fluoride for this reason.